What is HIV virus? HIV is a virus that causes acquired immune deficiency syndrome (AIDS). It is one of the most serious and life-threatening illnesses, affecting millions of people around the world. Definition of HIV. HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the immune system and weakens it, which makes it difficult for the body to fight off infections and disease. HIV is spread through unprotected sexual contact, sharing infected needles, or from an infected mother to her child during pregnancy, childbirth, or breastfeeding. If left untreated, HIV can progress to acquired immunodeficiency syndrome (AIDS), which is the most advanced stage of infection and has no cure. Structure of HIV. The human immunodeficiency virus, HIV, is a complex virus composed of two single-stranded RNA strands contained within an envelope. The envelope contains proteins which enable it to attach to and enter host cells, allowing its genetic material to be released into the cell. HIV also carries enzymes that help it replicate itself inside the host cell, as well as other molecules involved in virulence. History of HIV. It is believed to have originated in West Central Africa and was spread through blood contact between chimpanzees and humans. In 1983, researchers identified the virus as causing acquired immune deficiency syndrome (AIDS). In 1985, scientists developed an antibody test that could be used to identify the presence of HIV antibodies in blood samples. Effects of HIV virus. In terms of physical effects, HIV attacks the body's immune system, compromising its ability to fight off illnesses. This makes it easier for other infections to take hold in the body, leading to further complications such as pneumonia or tuberculosis. This can lead to even more serious health issues such as cancer or organ failure due to weakened immunity. HIV and AIDS are also a major cause of death for people aged 15 to 49 years old. Transmission of HIV infection. The HIV transmission is an important factor to consider when discussing the virus. In most cases, it's spread through contact with infected body fluids such as semen, blood, and vaginal or anal secretions. Unprotected sexual contact either with multiple partners or a single partner who is HIV positive is the primary mode of transmission. Other ways include sharing needles when injecting drugs and mother-to-child transmission during pregnancy, childbirth, or breastfeeding. Signs and symptoms of HIV. Early symptoms of HIV may include fever, rash, night sweats, fatigue, swollen lymph nodes or glands in the neck and armpits, muscle aches and sore throat. Later on in the course of infection, several weeks or months later, other signs such as weight loss, persistent diarrhea and yeast infections may appear. Diagnosis for people with HIV. Diagnosis of HIV is a complex process and must be done through laboratory testing. This testing involves measuring the presence of antibodies to the virus in the blood or saliva. If these tests are positive, further tests may be conducted to determine if the infection has progressed to AIDS. HIV prevention strategies. For individuals who already have the virus, taking steps such as avoiding unprotected sex and sharing needles with others can help reduce further risk of infection. It is important for people who do not have the virus to practice safe sex habits during sexual intercourse, limiting their number of partners, and getting tested regularly for HIV/AIDS. Treatment for HIV. Antiretroviral therapy (ART) is one of the most commonly used methods and involves taking medications on a daily basis. Another treatment option is pre-exposure prophylaxis (PrEP). Impact on society. In the early stages of the epidemic, people living with HIV were subject to stigma and discrimination in the form of fear and misunderstanding. This led to a lack of support for those affected, as well as limited access to treatment. Even today, many people living with HIV still face challenges such as unequal access to healthcare services or difficulty finding housing or employment due to their medical status. Conclusion. Understanding the basics of how HIV works and how to prevent its spread can be a powerful tool in the fight against this virus. There are many resources available today to help educate individuals on HIV, including online resources, support groups, and healthcare providers.